And there are very few people in the history of the US healthcare industry who had a bigger positive effect on American healthcare than Brian.
One more time for the people in the back. There's the chart. What a positive impact he had for the American people. All those people he denied. And not just him, his company. All those people whose lives he shortened.
Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up.
Hey, it's Jordan with Status Coup. We are now on day 5 of the manhunt for the shooter who killed the UnitedHealthcare CEO, Brian Thompson, and UnitedHealth Group, the parent company of UnitedHealthcare. Their CEO has a message for all those taking glee in the murder of Brian Thompson. Fuck you to the sick peasants. You will like the care that we deem necessary. This is probably not the answer if you are a healthcare company to turning that hate dial down. This is one of the most tone-deaf and evil statements I've ever heard. I'm going to play it in full. Again, this is the CEO of UnitedHealth Group, the parent company of UnitedHealthcare. This was a private message to employees. It was obtained by journalist Ken Klippenstein. Check out his work on his Substack. Here is what the CEO, Andrew Witty, had to say to all you evil, tone-deaf, soulless, lacking empathy peasants expressing glee to the murder of UnitedHealthcare CEO Brian Thompson.
I'm sure everybody has been disturbed by the amount of negative and in many cases vitriolic media and commentary that has been produced over the last few days, particularly in the social media environment. And I want to reassure you of a few things. Firstly, we are going to continue to make sure that we put patients, consumers, and members first, as we always have done.
They're going to continue to put patients and consumers first, as we always has done. Clearly, they're putting patients and consumers first, like they always have, to the tune of the most denials for care of any for-profit health insurance company. UnitedHealthcare, all the way at the bottom there, 32% denial, but they care the most. But it actually gets worse. So buckle up. And by the way, smash that like button, share this important video. This murder of this CEO has really awoken a sleeping beast, which is the sick, angry, rightfully angry American global people. There is response all over the world with horror stories for companies like this literally killing the masses. Here we go.
The mission of this company is truly to make sure that we help the system improve by helping the experience for individuals get better and better. There was nobody who did more to try and advance that mission than Brian Thompson. And there are very few people in the history of the US healthcare industry who had a bigger positive effect on American healthcare than Brian.
One more time for the people in the back. There's the chart. What a positive impact he had for the American people. All those people he denied. And not just him, his company. All those people whose lives he shortened. All those people who they dropped exorbitant amounts of stress on unnecessarily so that he could make more money. By the way, this guy, want to know his net worth? Want to know his salary there? $25 million he makes a year. This is who's lecturing the peasants. Like your care, or we'll make it even worse.
And we are going to make sure that we not only acknowledge and honor that legacy of Brian, but we'll continue it. Our role is a critical role. and we make sure that care is safe, appropriate, and is delivered when people need it. And we guard against the pressures that exist for unsafe care or for unnecessary care to be delivered in a way which makes the whole system too complex and ultimately unsustainable.
Ding, 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 ding. United Corporations of America, we have your winner. Let's break this down. Let's break this down. We are the guardians of the galaxy. We guard against the pressures that exist from you, the sick peasants, for unsafe care. Unsafe care. Check out my video that I did yesterday on UnitedHealthcare because of the hack to its subsidiary. It resulted in payments for providers and doctors being delayed or not even happening. So UnitedHealthcare then bought up the actual doctors' offices and the providers and even smaller hospitals. So they are the insurance company approving or denying for the providers that they have bought out. They are literally the deliverer and the recipient. I'm sure that care is very safe. I'm sure they are fully staffing the providers that they've bought, right? And I'm sure they're fully staffing the hospitals that they've bought, who now you have healthcare workers going on strike because nurses are literally doing, for one nurse, they are providing for 7 to 8 patients, which is very unsafe. But we guard against the pressures that exist for unsafe care or unnecessary care to be delivered in a way that makes the whole system too complex and ultimately unsustainable. So they deem what is unnecessary care. You want a few examples of what they deemed unnecessary? I have a few, and this is just a few. I could read you an avalanche of horror stories. But this one was particularly just heart-wrenching and evil from UnitedHealthcare. This is in a Reddit thread under what are the dirtiest things UnitedHealthcare did to you and your family. This is not for the weak at heart, by the way. So this is kind of long, but I think you need to hear it. My 52-year-old mom felt like her cancer had returned, was growing. They denied a scan my mom needed, saying she had to wait 8 more weeks because it had not been long enough since the last one. It was either 6 or 8 weeks at that point. I can't recall. It's been 13 and a half years. So they said, we're denying you because you have to wait 8 more weeks. Hold that thought, 8 more weeks. At any rate, without the scan, chemotherapy wouldn't be restarted or any sort of radiation. We could not afford to pay thousands out of pocket. I moved back home at 25 to help care for her full time and was, for the first time since 14, not working. She was barely working. Coworkers had donated their own sick hours at work so that she could keep her insurance. Let that sink in. Coworkers were donating their own sick time at work so she could keep the insurance that was denying her care for a scan to confirm that her cancer had come back. So they were donating their sick time so that she could keep the insurance policy that was actually killing her. We were barely scraping by. Things were stressful and money was already so very tight. After some ER visits and multiple medical issues, the time finally came. The cancer had started to spread to my mom's brain, but it was now too late for anything to be done. We were told they would have needed to start treatments weeks ago to prevent it getting to that point, and there was pretty much nothing that could really be done. We tried a few days of radiation, but she was the kindest person and cared about everyone she met. One day after we bought groceries with most of the funds we currently had left, I was driving home. She rolled down her window and handed a homeless man $20 and gave him a big smile. I wasn't shocked that she had given money, only that it was $20, which at the time was kind of a lot for us. She looked at me and said she had needed it said he needed it more than us and that we would be okay. I smiled and nodded back. We would be okay financially. That $20 was a lot to us, but it was so much more to him. We had food. The American Cancer Society had given us a gas card so we could afford to drive to and from the doctor. We were indeed going to be okay. We lost my mom when I was 25 and my brother was 24. It has made relationships difficult at times, and things like weddings, holidays, and birthdays are always a bit tainted with the sadness because she isn't there to enjoy them, nor is our dad. Our father passed away a few years ago as well. I really think the reason my brother hasn't had his wedding yet after a few years of being engaged is because he can't handle the thought of them not being there. UnitedHealthcare robbed us of more time with my mom. Maybe she wouldn't have lived another year with the scan and chemo when she first noticed returning symptoms, or maybe she would have lived a few years. We don't really know, but without the scan, without the chemo, without the radiation, we were actively taking coins out of the meter on her life instead of just refusing to feed it. UnitedHealthcare profits not just by denying claims, but also largely profits by delaying services. They hold on to their money and save thousands of dollars on my mom and people like her by essentially letting her die more quickly and not having to pay for additional chemotherapy or for radiation, extra doctor visits, and fewer overall hospital bills. They're a criminal enterprise operating under our noses by lining the pockets of lawmakers, forcing smaller healthcare facilities and independent pharmacies to close, limiting access to healthcare locations to millions of Americans, especially in smaller towns, and denying and delaying life-saving services, all while profiting billions and more every year. $90 billion October 2023 to September 2024. That is a horrible story. And UnitedHealthcare, in the grand scheme, what did they really save in those 8 weeks? 8 weeks, they claimed, was the reason that they denied they denied approval of that sick mother's scan. What were they saving? A couple thousand, maybe? Could have prolonged her life potentially by years if they would have caught the return of that cancer. And that is not considered murder in corporate media. That does not get 24/7 attention like the manhunt for this killer. But it sure greases the profits. Remember that UnitedHealth Group CEO that's lecturing you, the sick peasants, you will like the care that we deem safe and necessary. He makes $25 million a year. Want to see the other ones? Cigna, their CEO, $21 million. WellCare, $23.5 million. Humana, $16.3 million. Centene, which was Fidelis, as you know, we have covered for years. Fidelis Care in air quotes. They denied Danny Desnoyer, the son of Scott Desnoyer. They denied him his health care. They canceled his policy over an unpaid $20 bill. He was late and owed $20 to the company. They cut off his health insurance. He was taking life-saving medication for mental health, for his mental health issues. And because they denied his care over $20, he grew very, very depressed, suicidal, and drove himself in his car into a river and ended his life. And his father and mother and family has to live with that for the rest of their lives. We've covered it extensively here. I've interviewed Scott. Well, CEO of that company that canceled his treatment over a $20 bill. She's making almost $19 million. Molina Healthcare, $21.4 million. CVS Health, $21.6. Elevance Health, $21.9. And UnitedHealthcare, Brian Thompson, was making a cool $10 million. Now, to be clear, I'm not putting up these people's mugshots there and the money they make to encourage you to commit violence. I don't personally think going and gunning down CEOs is the answer or going to change anything, really. Violence begets more violence, and that violence is probably going to be coming back towards the peasants because they have the money to build a fortress around them. They have the money for an army of private security. They have the money basically to disappear and still kill you through immoral practices. But I'm also not for hiding the identities of these people that, make no mistake about it, their actual business model is murder. It's just not covered like that by corporate media because the corporate media is literally accepting money from them. The corporate media is part of the scam. They take ads, sponsorships from for-profit health companies. I want to show you another one. And I mean, it's easy to find these stories. Just type in Twitter, like healthcare horror stories. This is from a physician. This physician's appeal to UnitedHealthcare to authorize anti-nausea vomiting meds on behalf of a pediatric patient on chemo was denied. You don't hate these insurance companies enough. This is what he wrote to the insurance companies. Dear buttheads at the insurance company, I can't believe it has come to this. I have to take time away from my patients to inform you that you are idiots. This whole experience makes me want to vomit. But of course, I wouldn't dare throw up without the approval of my insurance company. Which brings me to my point. Apparently, you have decided that a child receiving chemotherapy has no reason to be nauseated. I didn't think I was unnecessarily writing prescriptions for antiemetics for name redacted. Obviously, you would know better about the side effects of chemotherapy than me, my peers, and the entire scientific community, going all the way back to Dr. Sidney Farber. I suppose my alternative to Zofran and scopolamine is to let identity redacted know that the nausea is all in his head. However, I don't imagine you would cover any psychology consultation either. So I'll just tell this person to stop throwing up. Thank you for that simple solution. You have saved your greedy, blood-sucking corporation shareholders a great deal of money. This guy should have a YouTube channel. Of course, that would be the bottom line. Feel free to contact me if you need further information about how much you guys suck. That is one hell of a doctor, and I would take my child. They were denying a kid with cancer nausea medication. Let that sink in. That's not a breaking news alert on CNN. Denying pediatric children with cancer nausea medication. I thought this was kind of all you needed to know. Says a lot. As a practicing therapist, hearing about the news that the CEO of UnitedHealthcare was killed, I just hope his family knows that grief counseling isn't considered medically necessary and is not covered by the UnitedHealthcare insurance before they get hit by any unexpected bills. You might say, Jordan, this family's grieving. People shouldn't be taunting. But isn't that the point? Why is this family's grief a higher priority than the grief of that individual who's read it thread I read to you, who lost their mother from cancer? It seems partially because UnitedHealthcare would not approve a scan to confirm that the cancer had come back. Is her grief not just as important as the wife and children of Brian Thompson? I feel for them as a human. They lost their father, husband. Apparently, Brian and his wife were living apart, according to reports, but whatever. Still had children. But it sure seems that the media has a different standard for whose grief and whose lives matter more. Here's another one that I found interesting. My dad battled prostate cancer, and UnitedHealthcare denied him experimental treatments that might have saved his life. I don't have sympathy for the CEO because there was none for my father, who fought to the very end and lost his battle with cancer. Fuck that CEO. You know, what's interesting about this, you keep hearing from the for-profit private health insurance industry and their accomplices in the media, the system needs to be like this because they need money. It's so expensive for research and development. These pharmaceutical companies, these for-profit health companies have to spend millions trying new drugs, experimenting. First of all, that's not exactly true either. A lot of that money that they use is going to marketing. But we need to keep this immoral for-profit healthcare system in place for experimenting and drug trials, but they deny patients routinely for experimental medication or treatment that could save your life if you have cancer. Yes, experimental, but by their standard, we need to keep the system as is because they need millions for drug trials and experimental drugs, but they won't actually approve you for said experimental drugs. Make that one make sense. And lastly, let me read this to you. UnitedHealth Group had a profit of $32 billion last year. By the way, profit. For context, the budget of the government of Bulgaria was $32 billion. Some have estimated that you could end world hunger for around $25 billion a year. Folks, this is only going to get worse. Even when this CEO, the murderer of the CEO is found, he likely will. I think a sleeping giant has been awoken. And maybe the Democratic Party wants to know why they keep losing elections. Maybe they should listen to the outrage out there, because the Democratic Party and the Republican Party, sorry, MAGA, Trump's not going to do anything about this either. He was literally just dining along with RFK with the CEOs of Pfizer and Eli Lilly at Mar-a-Lago. Don't think they were talking about better patient care over bread and caviar. Maybe if the Democratic Party actually did something about this, maybe if they stopped selling the government to healthcare companies and actually provided universal healthcare and got rid of this bureaucratic Byzantine maze of a system that serves nobody but rich fucks. We don't need these middlemen. We don't need faceless bureaucrats approving or denying life-saving care. Or in the words of UnitedHealth Group CEO, we guard against the pressures that exist for unsafe care or unnecessary care to be delivered in a way that makes the whole system too complex and ultimately unsustainable. What he really means by that, we guard to maintain the corporate, deadly for-profit system at your expense. Please support Status Coup if you are new here, subscribe, and please, if you can, consider signing up as a paying member so we could continue our on-the-ground reporting. Check out under our playlists, Medicare for All and Healthcare. We have been on the ground for years covering protests for universal healthcare, interviewing people who have lost loved ones on the ground, not just in a studio. It costs money, and we will continue doing it as far as you fund us.